If you're experiencing painful intercourse after menopause, I need you to know something important. You're not alone. This affects up to 60% of postmenopausal women, and there are real medical solutions that actually work. I'm a physician, and what I'm about to share could transform your quality of life. Here's what's happening. After menopause, your estrogen levels drop dramatically. Estrogen is what keeps your vaginal tissue thick, elastic, and well lubricated. Without it, the vaginal walls become thinner, drier, and less flexible. This is called vaginal atrophy, and it's the main reason intercourse becomes painful. The tissue can even tear easily, causing bleeding and increased discomfort. So here are 5 medical solutions that actually work, backed by science. First, vaginal estrogen therapy. This is a low-dose estrogen cream, tablet, or ring that you insert directly into the vagina. It's not the same as taking estrogen pills for your whole body. This stays local and dramatically improves vaginal tissue health within just a few weeks. Studies show it's effective in over 80% of women, and it's considered very safe even for women who can't take systemic hormone therapy. Second, vaginal moisturizers. These are not the same as lubricants. Moisturizers like Replens or Hyalogyn are used regularly, 2 to 3 times per week, whether you're sexually active or not. They provide continuous moisture to vaginal tissues and help restore the natural pH balance. Think of them like moisturizer for your face, but for vaginal tissue. Third, prescription DHEA vaginal inserts. DHEA is a hormone that your body converts into both estrogen and testosterone locally in the vaginal tissue. The brand name is Intercourse. Clinical trials show it significantly reduces pain during intercourse and improves vaginal health without raising hormone levels in your bloodstream. Fourth, vaginal dilators combined with pelvic floor physical therapy. Sometimes the vaginal opening becomes so tight and the muscles so tense from chronic pain that you need physical retraining. A pelvic floor physical therapist can teach you exercises and techniques, and dilators gradually and gently stretch the vaginal opening. This might sound uncomfortable, but it's actually very effective when done properly with professional guidance. Fifth, and this is newer, laser therapy for vaginal rejuvenation. Treatments like Mona Lisa Touch or Femi Lift use fractional CO2 lasers to stimulate collagen production and improve blood flow to vaginal tissue. It typically requires 3 treatments spaced a few weeks apart. Studies show about 70 to 80% of women experience significant improvement. It's not covered by insurance and costs between $1,500 to $3,000 total, but many women say it's life-changing. Now here's what you need to understand. Painful intercourse after menopause is a medical condition, not just something you have to live with. It's called genitourinary syndrome of menopause, or GSM, and it's treatable. But here's the problem. Most women suffer in silence. They're too embarrassed to bring it up with their doctor. Meanwhile, it's affecting their relationships, their self-esteem, and their quality of life. Many women think if they just use more lubricant during sex, that'll solve it. Lubricants help, and you should absolutely use them. But lubricants alone don't address the underlying problem, which is that your vaginal tissue has physically changed and needs medical treatment to restore its health. Also, this condition gets worse over time if left untreated. The longer you go without treatment, the more the tissue atrophies, and the harder it becomes to reverse. So if you're experiencing pain, dryness, burning, or bleeding with intercourse, don't wait. Talk to your doctor now. What should you say? Be direct. Say, I'm experiencing painful intercourse since menopause, and I'd like to discuss treatment options including vaginal estrogen therapy. A good gynecologist will not be shocked or judgmental. They deal with this every single day. If your doctor dismisses your concerns or tells you it's just part of aging and there's nothing to be done, find a different doctor, because that's simply not true. One more critical thing. Some women avoid intimacy entirely because of the pain, and that creates a vicious cycle. The less you're sexually active, the more the vaginal tissue atrophies. Regular sexual activity, even just self-stimulation, actually helps maintain vaginal health by increasing blood flow. So treatment isn't just about intercourse, it's about overall vaginal tissue health. And for those worried about hormone therapy, let me be clear. Vaginal estrogen is very different from the hormone replacement therapy you might have heard warnings about. Vaginal estrogen stays local. It doesn't significantly increase estrogen levels in your bloodstream, which means it doesn't carry the same risks. Even women with a history of breast cancer can often use vaginal estrogen after discussing with their oncologist. Here's your action plan. First, schedule an appointment with your gynecologist or primary care doctor. Second, be specific about your symptoms. How long has this been happening? How severe is the pain? Is there bleeding or burning? Third, ask specifically about vaginal estrogen therapy and the other treatments I mentioned. Fourth, don't accept it's just aging as an answer. Demand real solutions. Painful intercourse after menopause is treatable. You deserve to be comfortable. You deserve to enjoy intimacy if you want it. And you deserve to have healthy vaginal tissue regardless of your age or whether you're sexually active. This is a quality of life issue, and there are proven medical solutions. If this information helped you, please share it with other women who might be suffering in silence. This is one of those topics women don't talk about enough, but we need to. Postmenopausal women deserve accurate medical information and effective treatment. Follow Golden and Gray Hub for more honest health information for your best years. Take care of yourself, speak up for your health, and remember that you don't have to live with pain.